Brian Bergmark, Mike Gibson coming to you live from ACC 2024, and we're talking about a new drug, Olezarsen. I hope I said that right, Brian, in the treatment of triglyceridemia. Just did a phase 2 study. Talk to us a little bit about why you did it, what you found.
Yeah, thanks so much for having me. So, in the broader picture, there's been a lot of attention to lowering low-density lipoprotein cholesterol. There's this other end of the spectrum of triglyceride-rich lipoproteins, which are thought to be at least as atherogenic as LDL. And so there are several new targets being investigated for lowering triglyceride-rich lipoproteins. One of them is apolipoprotein C3. So Olezarsen is an antisense oligonucleotide injected monthly that targets ApoC3 mRNA. And so in so doing reduces triglyceride levels. And so the purpose of this trial was to look at two doses, 50 milligrams monthly and 80 milligrams monthly, among people with hypertriglyceridemia.
And what did you find?
So both doses significantly reduced triglycerides by about 50% at 6 months compared to placebo. We also importantly saw reductions in apolipoprotein B and non-HDL cholesterol, markers of atherogenic risk. And so that's important to us thinking about whether, in addition to lowering triglycerides, which can be important clinically on its own, whether there might actually be a role for reducing cardiovascular risk as well.
So the role of triglycerides in its causal effect is a little bit of mystery wrapped in enigma that's a riddle topped in secret sauce. What's your take on that, Brian? I mean, is it causal? Is it a direct mediator of events?
Yeah, so this gets complicated in ways, as you're saying, that I don't pretend to fully understand, nor do I know that anybody really does. But in the end, so there can be shifting of the triglyceride molecules between these various lipoprotein-containing particles, and I think to the extent that that happens, that's probably not all that helpful. If in the end there is clearance of apolipoprotein B, as can be sort of measured by a surrogate of non-HDL cholesterol, everything would suggest that that has potential for lowering somebody's risk for atherosclerosis. And so one of the limitations of some other drugs that have specifically targeted triglycerides in the fibrate world, for example, is even though the measured triglyceride level goes down, there's not a lowering of apolipoprotein B. So I don't know for certain, but the fact that that goes down with this drug is certainly encouraging. We are investigating this further. We have another trial called Essence in a similar population where we have a coronary CT substudy. So patients get a coronary CT at baseline and then after a year of treatment. And I think that will give us a much better sense of whether something meaningful is happening at the vessel level with atherosclerosis to correspond to what we're seeing with the measured lipid parameters.
Excellent. Well, thanks, Brian. Congratulations on this phase 2 study. Thanks for joining us. And thanks to all of you for joining us here live from ACC 2024.
Thanks so much.